When I enroll into Medicare for the first time, which is better to have, a Medicare Advantage plan or a Medicare supplement? If you're approaching Medicare for the very first time, that's one of the very first things you're going to need to grapple with, and it can be very confusing. Every industry out there has its perennial argument that never dies. Inside of Medicare, it's that choice. Which way to supplement your Medicare? Should you go with a Medicare Advantage plan or a Medicare supplement? That's what we're going to look at today. But for now, my name's Ron Plusinski. I own the Integrity Agency. I also have this channel here called Health Insurance Simplified, where we aim and provide you very simple, everyday answers to all your health insurance and Medicare insurance questions and confusion. We want to clear that up for you. So, back to today's question. Which is better to have when you enroll into Medicare? Medicare Advantage or Medicare Supplement? Now, I hope you've already watched the short video at this channel. If you didn't, go back and look for the short video entitled Medicare War. And it talks about the war that can sometimes exist within Medicare over that exact issue. Which is better? It's very unhelpful to approach it as in one is better than the other. That stilts it, that kind of poisons the well, so to speak, before you actually make your decision. What you need to know is it's not that one is inherently better than the other. There are merely two different ways to get your Medicare health insurance needs given to you throughout your retirement year. We want you to enjoy your retirement, to get the most out of it, to have fun. You've worked hard all your life to get here. We want to make it simple for you now to enjoy it. And that includes simplifying your Medicare process. Because your Medicare health insurance is the health insurance you're going to have from age 65 for the rest of your life. So you need to make appropriate choices. Now, one day I was sitting in my local provider's office and I had checked in at the front desk and I was sitting there in the lobby waiting to get called back to see the doctor. It was obvious the front desk clerk was having a conversation with another patient in the room that she apparently knew. That patient was approaching Medicare for the first time. And I heard the desk clerk blurt out pretty confidently, "Don't go with Medicare Advantage. It's got hidden costs." I could not believe it. Now, first thing you need to know, that is furthest from the truth. There are not hidden costs inside of Medicare Advantage. In fact, quite the opposite. Medicare Advantage is a privatized version of getting all your Medicare coverages in your retirement. Medicare Advantage was voted into law by the federal government on CMS, Center for Medicare and Medicaid Services. They are the watchdog behind everything related to your Medicare, and they watch it closely. Believe you me, they watch it closely. There's no fool's play inside of a Medicare Advantage plan. Everything has to be documented plainly for you. Even more, Medicare Advantage plans are rated by the U.S. government on a star rating system, 1 star being the worst, 5 star being the best. And then annually, these privatized Medicare Advantage companies, they must submit their plans every year to the federal government to have them reviewed. So there's no funny business inside of Medicare Advantage, okay? I'm sorry, but that front desk clerk did not do that other patient any favor by saying there were hidden costs. Now, no doubt that front desk clerk, when she went through her Medicare process, apparently had a very bad experience. Maybe that's because she tried to do it on her own. Maybe that's because she called a 1-800 number rather than working through a local independent broker like the Integrity Agency. So yes, she had a bad experience. You can have a bad experience in your Medicare, whether you go Medicare Advantage or Medigap supplement. Okay, so let's get back to the central point. One is not better than the other. It's probably more effective, more appropriate to say they're merely just two different ways to have your health insurance needs delivered to you throughout your retirement, and the one that resonates best with you as we sit down together and unpack the structure of Medicare Advantage, unpack the structure of Medicare Supplement. The one that resonates most with you is no doubt going to be your best choice. And when you get up from our meeting, you can be confident you're going to be well taken care of. Now, there are some significant differences between the two, yes. For instance, Medicare Advantage is what you and I would call managed care. There are cost savings techniques like networks. There are provider networks involved. You can have an HMO, health maintenance organization, which means there's a very defined network list of doctors you must choose from if you want that service covered at all. With Medicare Advantage, there's also something called a PPO, a preferred provider organization, which really starts off as the same thing. A PPO plan has the exact same network list of doctors as the HMO does, but a PPO simply gives you the flexibility to go outside of that network if you go in Medicare Advantage. You pay a little bit higher copay, you have a slightly higher deductible, but you can do that. So you see, even with Medicare Advantage, there's flexibility. You can do an HMO, you can do a PPO. And remember, Medicare Advantage is managed care. That's one way they manage costs is networks. Another way they manage costs are other techniques called prior authorization. So if you go in, a doctor thinks you need an MRI, a doctor thinks you need a particular medical service, they will need to submit paperwork to your managed care plan, your Medicare Advantage plan, who will review it and get back to the doctor if it makes sense to do that or not, or if they think it's a wasteful upfront service. So probably the single most well-known thing about Medicare Advantage is that it's managed care. They're going to pinch their pennies. But the reality is, if you're hitting Medicare for the first time, you're coming off a group health insurance plan, or you're coming out of the healthcare marketplace, that is another form of managed care. So if you like Medicare Advantage because it's the all-in-one wrapped up with a bow on it, so to speak, given to you, your one Medicare Advantage plan encompasses all other parts of your Medicare. If you like that, if you like the fact that Medicare Advantage will oftentimes throw in some free dental, vision, hearing, some fitness, and some other things, and it's way more economically priced per month, then that's your decision. Maybe Medicare Advantage is better for you. Now, the other option you have, Medicare Supplement, also called Medigap insurance plans. The word gap there because it is intentionally going to fill the gaps in your original Medicare. Now, remember we said Medicare Advantage is a privatized form of your Medicare. Medigap Supplement is not. If you want to go with a Medigap Supplement, that means you're going to stick with your original Medicare, that traditional red, white, and blue card you're going to get that says Medicare Part A, Medicare Part B. To that, you can add a Medigap Supplement that merely gets towed around, so to speak. I like to give an illustration of, think of your original Medicare with a trailer hitch on the back. It's towing around your Medicare Supplement, your Medigap plan. The thing that always pays first is that red, white, and blue card, your Medicare Part A or your Medicare Part B. In other words, Uncle Sam. Uncle Sam will always pay first. And then what Uncle Sam does to pick up for that Medicare eligible service, your Medigap Supplement will take the rest of that. Oftentimes, if you're in the most robust plan, which right now is Plan G, as in golf, Plan G, it can come with quite a price. That is the difference. Whereas Medicare Advantage is economically priced, Medicare Supplements, that might be the better option for you. Just know it does come with a heftier upfront monthly cost. So the way I like to say is, one is back-end loaded with your financial exposure. That's Medicare Advantage. You have cost sharing along the way. The other is front-loading your potential back-end medical needs. That's called Medicare Supplement. And they front-load it because it has quite a higher monthly premium on it. Now, if it helps, even the main Medicare website, medicare.gov, will explain the difference this way. If you are a senior approaching age 65 and you like the thought of manageable, predictable monthly costs for your health care in retirement, then you should probably consider Medicare Supplement. If you need something more economical, you don't mind cost sharing along the way, like deductibles, co-insurance, but you like the idea of some free dental, vision, hearing, fitness, you like the simplicity of Medicare Advantage, there's only one card you present, then okay, Medicare Advantage might be the option for you. So there you have it. It's not that one is better than the other, merely two different ways. Hey, reach out to the Integrity Agency. I'll be more than glad to help you unpack these two options further and see what's best for you. And do me a favor, while you're still watching, take just a moment to subscribe to this channel, like this video. Let's get the word out that we are here to simplify your Medicare and your health insurance needs. Now, as I always like to say, stay active, be well. See you next time. Bye-bye now.